Hi there, I'm Dr. Paul, the Confident Smile Creator at Absolute Dental Care here on Morrow Street at Taringa. As healthcare professionals, you actually might not be aware of the extraordinary lengths we go to keep you safe. In this little video, I'm going to go through a few little things that we do in here and the steps that we go through to make sure that all the treatment that you require, you are kept safe at all times. Even here at reception, we go through with screening patients, whether they've been sick recently and whatnot, making sure that other people don't get infected from around us. We go make sure there's alcohol wipes here on hand as well, and even the time with COVID virus, we're actually taking temperatures of people to ensure that there's no fevers that are running. Once again, we're going to take a little tour around the practice and have a look at some of the things that we do. So please join me as we go next into our stereo room. So everyone, once again, this is our sterilising room, and our lovely Chen, who's over here. Chen is one of our dental assistants here. She's also controls the sterilising room to make sure that all the instruments are kept clean and safe. What we're going to do is go through the sterilising room and show you some of our procedures that we have. Our sterilising room is really mapped out into 3 specific areas. Over here on this side is where you can just see the red lights that are there. That's our dirty area. That's where all the instruments, when they come in these lovely little cassettes that Chen's holding up here, they come in and they get placed on that side. Then it goes through a process of going through our washer and our steriliser, which we'll come through to very shortly. And once they've gone through that process, it comes over onto the clean side, which is our green side. So as we know, it is red is dirty, green is clean, and the section just off to my camera where you can see it's blue is somewhere in between, because that's where the instruments are passing through. All our instruments are also tracked by our computer, which sits here, so we know that every cycle that every load of instruments goes through has been done correctly. So the first thing we're going to show you about the trays, and Chen's got the instrument tray that sits here, if you can see it, and whatnot. All our instruments are kept in there, so once it leaves the surgery and comes into here, there's no more scrubbing of instruments anymore. That is certainly 1970s type material. It goes into these, and the cassette gets closed up, and then it gets pushed into our instrument washer, which is down there. So just might angular down this a little bit. This is our instrument washer, so Chen's going to pull that out for us. And as you can see, all the trays get loaded into there, and they go through. It's basically what it is. It's an instrument washer. It's like a dishwasher at home, if you like to look at it that way, but it's at a much higher temperature. It's about 90 degrees Celsius, and it uses a number of chemicals that are in it as well to actually break down all the debris that's on our instruments, and basically we get a clean instrument. So all the instruments come out clean. At that stage, they're not sterile, but they're certainly clean as they come out of that, and it's a very efficient way. And it takes about 66 minutes for it to run through those procedures. From there, we take it from that instrument washer into our autoclave, or a steam steriliser, as some people know about it. And Chen will just open that up here. What happens is those instruments, you've got one of those cassettes there, Chen, so they get loaded into the steriliser there, and it goes through a cycle. And those cycles can take about 45 minutes. Gets it to 134 degrees Celsius, and really kills everything that's in there. And that's certainly above the standard that we've got. Once those instruments have been finished in the autoclave or the steam steriliser, they then come out onto this side of the room, and they're left to cool, and then they can be used for patients once again. There's a number of indicators that we actually use as we go through this. Before they go into the instrument washer, we have some little tags on there, and these little tags show whether the instruments have been, or the wash has actually gone through properly or not, and they actually change colour. If it doesn't change colour, it means it's failed. So that's, full well whether those instruments worked or not. So we're just going to take a close up there. Chen, you want to go right close to the camera there. The one on that side is the green one there. That's to show that what it is before they go in. And when they come out, if that green colour's disappeared, we know that it's actually been washed correctly. Thanks for that, Chen. Also then, as it comes out of the autoclave, it's always monitored by the computer as well to make sure that it's gone through their proper cycles, and it can't be approved unless those cycles have gone through. But in addition to that, we actually have these little bags. And some on these little bags and whatnot, we have these little indicators that are on the top. This one on the outside is clear when it starts, and when it actually is steam sterilised properly, it turns to brown. That's another indicator. It's not always the best thing in the world to rely on. We have to make sure that all the instruments have been through properly. There are some other biological ways that we can go through as well, and that way we keep control of our autoclave. Not only that, our autoclave is also serviced annually by law, where I have to get it certified every year to ensure that it's doing the right thing as well. These are just some of the steps we go through, as well as what we do for the normal cleaning in our surgery, everyday life, where everything gets wiped down with neutral detergent followed by alcohol wipes. And we all wear masks, and we change those between every patient. We change gloves every time we've got to take the gloves off. We've got to change those over as well. All these things are done to protect your safety. Once again, I'm Dr. Paul from Absolute Dental Care, and this is the lovely Chen. We look forward to seeing you next time at your visit. And if you have any queries, please come down and give us a yell.